Hi, my name is Jessica. I'm going to be the nurse practitioner doing your cardiac exam today. Before we get started, can I have your consent for the video to be viewed by the USU faculty unlisted on YouTube?
Yes.
Okay. Can you start off by giving me your name and date of birth, please?
Karen Bilagloy, June 2nd, 1966.
Okay. First, I'm going to be taking your blood pressure in both of your arms, your right and your left. I'm going to be doing this while you're laying down and while you're sitting up. For purposes of this video, we don't have a blood pressure cuff, so we're going to state that we did that.
Okay.
The arms, blood pressure in each arm should not be much different from each other. After that, I'm going to be assessing your jugular venous pressure. I'm looking for any distension. I have you laying at about a 30 to a 45 degree angle. What I'm going to do here is I'm looking at the area. I'm going to have you turn your head that way a bit so I can see the pulsation a little bit better. I can identify clearly the highest point of pulsation. I'm going to mark that with a straight object. I'm going to take my tape measure here. I'm going to measure it to the sternal notch from that area. I'm having it horizontal to the floor where I marked it here. Okay, so we have 2 centimeters, and less than 3 centimeters is a normal finding. I'm going to have you turn this way now, and we're going to do the same thing on the opposite side. So again, I'm finding the highest point of the pulsation that I can visibly see. I'm marking this with my straight object at a horizontal angle, parallel to the ground. I'm going to take my measuring tape again. I'm going to measure this here to her sternal notch. And this is also 2 on that side, which is a normal finding. Next, I'm going to be assessing your carotid arteries. I'm just going to have you sit up and face the camera so we can have a better view here. I'm not going to be palpating these at the same time. I'm going to be doing it one at a time here. I can feel a brisk upstroke. A nice strong pulse. Now I'm going to feel the other side here. Okay, the patient has a good pulse. There's no thrill felt. If we did feel a thrill, this would give us more of a reason to want to auscultate the area to identify any bruits which could indicate some cardiovascular disease. So I'm going to listen with the bell and the diaphragm next. No bruits noted. I'm going to listen on the other side. For purposes of the video, I'm going to stay here so that we can have a better view. Okay, and again, I'm listening with the bell and the diaphragm as I do this. The next thing that we're going to do is I'm going to be looking at the chest and the trunk area. I'm visually inspecting the chest. I'm not seeing any precordial pulsations at all. For purposes of this video, we're leaving her tank top on, but it would be best seen with the naked eye to the skin. I'm going to be I'm going to be inspecting the area of the point of maximal impulse, the apical pulse, which is in the 5th intercostal space on the left side on the mid-clavicular line. I'm going to, do you want me to leave your shirt on or pull this up?
It doesn't matter, you can pull it up.
Okay. We're going to identify the, okay. So it's going to be about right here, the 5th intercostal space, mid-clavicular line. I'm just visually inspecting this right now, and I'm not seeing any pulsations visually at the point of maximal impulse. The next thing that I'm going to be doing is I'm going to be inspecting the abdominal aorta. So that's going to be 2 to 3 centimeters above the umbilicus. And I'm just going to lift this up a bit here. Right here is good. And just visually looking at it, I'm not seeing any pulsations in that region. This is without palpating, just inspecting. Okay, I'm going to have you sit up again. Thank you. The next thing I'm going to do is I'm going to be palpating all the areas of auscultation. So I'm going to be feeling here over the aortic area. I'm not feeling any thrill, which is a vibration, under my fingers, and I'm not feeling any heaves or lifts, which would be caused by the heart being enlarged with cardiomyopathy, actually hitting the chest wall, causing some lifts. I'm not noting any of that with palpation. I'm next going to palpate the point of maximal impulse, as I discussed, the 5th intercostal space, midclavicular line. And I can very clearly feel this pulse. Okay. I'm now going to palpate the abdominal aorta.
Lean back?
Yeah, I'm just gonna have her slightly lean back for purposes of this video, and this is gonna be located about 2 to 3 centimeters above the umbilicus again. So use my fingers for measurement landmark purposes. Go up a bit. And I'm feeling the pulse of the abdominal aorta. Okay. The next thing that I'm going to be doing is I'm going to be auscultating these areas. I'm going to have you sit up again for better visual of the camera. The first area I'm going to be auscultating with both the bell and the diaphragm is the 2nd intercostal space on the right sternal border. This is the aortic area. This is again with both the bell and the diaphragm. The next area that we're going to be assessing is we're going directly across the 2nd intercostal space on the left sternal border. This is called the pulmonic area. While I'm here, I'm going to ask the patient to inhale What I was looking for when I asked the patient to inhale was at the pulmonic auscultatory region, sometimes you would hear an S2 splitting at this point. An S2 can happen in a normal, healthy individual, or it could happen in someone who's having some cardiovascular disease. In a normal, healthy person experiencing this S2, it would be heard at the pulmonic area. This is because the aortic and pulmonary valves that normally close at the same time, the pulmonic valve is slightly delayed, so it's closing a bit later. That's causing the second S2 to be heard here at the pulmonic. Now, if you're hearing the S2 in any other regions, that is more indicative of pulmonary hypertension or atrial septal deviation. So this is where you would assess that. It's best heard on inhale, when the patient inhales. I'm going through and I'm also just looking for murmurs this entire time as I'm doing it, the cardiac assessment. The next area that we're going to be going down to is the Erb's point. We're going down just 1 intercostal space to the 3rd, and I'm going to have her inhale and then exhale, because at this particular region, it's the murmurs are best heard on exhale. So I'm just going to find my landmarks again here. Okay, we're right here. Inhale and exhale for me. Okay. The next area that we're going to be going to is we're going down from the herbs, which is the third intercostal space. We're going down to the fourth intercostal space, which is the tricuspid area. I'm going to be, again, listening with my belly and my diaphragm. Just going to find my landmarks again here. The next thing I'm going to be going down, the second intercostal space was the pulmonic, the third was the herbs, the fourth is the tricuspid, and the last space we're going to go to is the mitral, or the point of maximal impulse area. It's the fifth intercostal space, the midclavicular line. So we're going away from the sternal border and we're going to the midclavicular line. And here I'm going to auscultate with the bell and diaphragm as well. I'm going to be lifting up her shirt a bit to find the space here.
Let me lean back.
I think you can see it fine there, yeah. Okay. No murmurs heard in any areas that I auscultated. The next thing I'm going to do is I am going to have you lean back for purposes of the video to auscultate the abdominal aorta. I'm going to lift this up if you don't mind. And again, we're going 2 to 3 centimeters above the umbilicus for this. There's no bruits heard in that area. I'm going to have you sit up a bit. The next thing we're going to do is we're going to go to the peripheral assessment. I'm going to, I'm not sure if in the video you can see your legs the best, so maybe you could sit back in the chair, or in the couch, yeah, and put your legs up here, that would be great. Next I'm going to be assessing all 4 extremities. I'm looking for consistent color and warmth on all of her extremities, which there's normal skin coloring. I don't notice any varicose veins. There aren't any shunts that I can see. I'm touching her legs bilaterally to assess for any edema or swelling, which I don't see at all. I'm checking for any pitting edema with my fingers upon palpation. I don't know any swelling. I'm looking at the patient's hands, and I don't know any swelling. Her ring seems to fit her normally without any swelling around that ring. I'm going to next check her capillary refills. I'm going to press on her fingernail and briefly pick it up, and within a few seconds, less than 2 seconds, you should notice the blanching come back in color, and which it did on her fingers. I'm going to be assessing her fingernails for any splinter hemorrhages, which could be a sign of endocarditis, which in their little black lines on the finger. I'm also looking for, and I'm going to look at both hands, I'm looking for any tarring, which happens with smokers. The actual nicotine and products from the cigarettes can tint the fingernails a yellowish color. The next thing I'm going to do is I'm going to check the capillary refills on her toes. I'm going to do the exact same thing that I did on her fingers. Pressing, blanching, pressing and blanching, and her color returns within 1 second. And I'm not noting any abnormalities on her toenails either. Her legs feel nice and warm bilaterally as well. The next thing I'm going to be doing is checking for your pulses. I'm going to, I think for this part, I'm going to have you just put your head back on the pillow, please. Yep. I'm going to begin by checking her femoral pulses, which I'm not going to be pulling down her pants, of course, but it's right at the corners of the groin to give it the best description. I hope that this can be seen in the video. Would you mind actually just standing here so that it's better viewed in the video where exactly I'm touching? I'm touching right here on both sides. And I can feel that bilaterally, the pulses. Okay, I'm going to have you lay back down, please. The next thing I'm going to assess is the popliteal pulses. And I just want to make sure this can be seen in the video, your knees here. Okay, perfect. Okay. Yep. Popliteal pulses. I'm going to be with 2 hands going behind the knee. And I'm going to have my fingers touch, and I'm going to slightly move them apart. And I'm pushing in behind her knee to feel her popliteal pulse. Okay, and I can feel that there. I'm going to now be doing the other leg. I'm going to have you slightly bend a bit. And again, I can feel that popliteal pulse underneath my fingertips. The next thing that I'm going to be assessing is that I'm going to have you just scoot your leg up for purposes of the video. Yep. Thank you. I'm going to be assessing, can you put it on my leg so you can see the dorsalis pedis pulse, which I can feel under my finger, a nice strong pulse. Now I want to make sure that everything is symmetric bilaterally to make sure that we're not having any peripheral vascular disease, any extremity that is cool, has a lack of pulse, is of concern. So I'm going to be now checking the dorsalis pedis on the other foot. Okay. Then I'm going to be checking the posterior tibial pulse. And that's, I'm going to go on the inside of the malleus bone here. I'm going to lift this leg so we can see exactly where I'm touching. Going over, and I'm feeling right on the, I'm going around the malleus bone to feel that pulse there. Okay, so we felt those bilaterally. Then I'm just going to work up to your upper extremities. And for video purposes, can you just put them on my legs so we can see it a little bit better? I'm going to be assessing the radial pulse on both extremities. Both pulses felt strong and equal bilaterally. Next, I'm going to feel the brachial pulse on both arms. I'm going to do this at the same time. Okay, and those are equal strong pulses bilaterally as well. So that concludes our cardiac assessment today. Thank you for being my patient.
Thank you.
I hope I didn't miss anything.